Welcome again. We are talking about birth defects and prenatal diagnosis. And now we'll take a look on the maternal causes. This is the fourth subsection of this presentation. In this, we'll talk about maternal diseases, how nutritional deficiencies and heavy metals may cause birth defects, and what is the role of obesity and male-mediated teratogenesis. Maternal diseases. Diabetes, very common in Southeast Asia. It may lead to stillbirths, abnormally large infants, congenital malformations. Risk is 3 to 4 times higher in insulin-dependent diabetic mothers. There are two types of diabetes, insulin dependent and non-insulin dependent. Open your books, open your Davidsons, and take a look into that. The risk is 80% higher in mothers with long-standing diabetes. The risk of what? The risk of birth defects. It can cause caudal dysgenesis. Now again, caudal means cranial is towards the head, caudal is towards the feet, and dysgenesis is improper formation. So it may lead to caudal dysgenesis. Insulin is not teratogenic in itself. However, the fluctuating levels of glucose, primarily the elevated level, has the potential to cause malformations. Now we have phenylketonuria. I am not going to go into the detail of phenylketonuria. For that, you may refer to Lippincott or any of the books you have. Mothers are deficient in phenylalanine hydroxylase enzyme. In this condition, as a result of which there is increase in the phenylalanine in the serum. It may cause mental retardation. Again, retardation is the decrease in capability of an individual. Microcephaly is a small cranial vault, and cardiac defects. Now, nutritional deficiencies, a very, very important topic, very much highlighted by the mainstream media, the news, the TV, the internet. However, there are no solid association between birth defects and vitamin deficiencies could be established as of yet. Iodine deficiency can cause cretinism. It's a congenital iodine deficiency that may lead to decreased growth and stunting. And poor nutrition contributes to low birth weight and birth defects. With nutrition, the important thing is to keep eating during pregnancy. Pregnancy is characterized by specific cravings. Cravings are specific for every person. You may or may not have cravings during your pregnancy. However, one should keep in mind that one has to eat for herself as well as the developing fetus. Having a good diet, rich in nutrients, rich in carbohydrates, proteins, fats, minerals, helps the fetus to grow. So it is always recommended to have a balanced diet during pregnancy so that your child, your fetus can develop normally. However, if you do not have a balanced diet, if you're on a poor nutritional regimen, it may contribute to low birth weight and certain birth defects. So heavy metals, I put a periodic table in here just to remind you of the large number of metals. The central elements in our periodic table are metals. They're abundantly present in our environment, and most of them are dangerous for the body. When greater amount of them is exposed, when the body is exposed to a greater amount of them. So organic mercury may cause neurological symptoms which are similar to the cerebral palsy. There's occupational exposure in these conditions which must always be ruled out in case of Heavy metal. Lead may lead to growth retardation, neurological defects, and increase in abortions. Then again, I'll say there is occupational exposure, which must always be ruled out in case of heavy metals. Obesity. Now, pregnancy obesity is defined as having a BMI of more than 30 kilogram per meter square, a 2 to 3 fold increase in the risk for neural tube defects. What were the neural tube defects? One of them was, yes, failure of closure of the anterior neuropore, as a result of which anencephaly occurs, and it is not compatible with life. Causation has not yet been determined. It may relate to maternal metabolic disturbances affecting glucose, insulin, or others. Hyperglycemia mainly contributes to teratogenesis. Pre-pregnancy obesity increases the risk of heart defects. Omphalocele is defect in the ventral abdominal wall when the physiological herniation of the intestines do not come back within the abdominal cavity. There can be multiple other anomalies and obesity in the child. So it is very important to control your weight, do moderate healthy exercise, and keep an eye on the developing fetus in a pregnant obese female. Now, let's take a look on male-mediated teratogenesis. Exposure to agents like ethyl nitrosourea and radiation may cause mutation in the male germ cells. Mercury, lead, solvents, alcohol, cigarette smoking may lead to spontaneous abortion, low birth weight, and birth defects. Now we have advancing paternal. So, when males are within a certain age limit, the offsprings are usually normal. It is a very wide bracket, however, with advancing paternal age, limb and neural defects increase, the chances of Down syndrome also increase. There are new autosomal dominant mutations that may occur in the fetus. When a fathering male, is less than 20 years of age, there's an increased incidence of having a child with the birth defects. Twofold chance of having an affected child if the male himself had a birth defect. Paternal toxicity, any form of paternal toxicity, occupational, non-occupational, sexual, may be transmitted through the seminal fluid. So, this was a small section. In this section, we talked about various maternal diseases, primarily diabetes and phenylketonuria. Then we talked about obesity and male-mediated teratogenesis. We also touched heavy metals and how they can cause teratogenesis in a fetus. In all of these conditions, the important thing is to manage what condition you might have. In case of obesity, try to decrease your weight, try to have a moderate exercise in your life. That helps with your regular everyday work as well as your pregnancy. In case of other conditions like heavy metal poisoning, limit the environmental exposure, try to live in a green healthy environment. As for nutritional diseases, which we covered in the previous section, you should always go to a nutritionist and ask for a proper balanced diet throughout your pregnancy. If you like this section, do watch other sections of this video. Keep watching sqadia.com. Thank you.